In our most recent video, we did an overview about diabetes and discussed the three major types: type 1, type 2, and gestational diabetes. In this video, we will take a deeper and more personal look at type 1 diabetes through the lens of Heather and her daughter Nora, who is diagnosed with type 1 diabetes. Heather and Nora are friends of the PATH community. Let's start with Heather first. Heather was asked when and how did she learn that her daughter Nora had type 1 diabetes. When Nora was 3 years old, she went through a week or so where she was a little out of sorts. She was not acting like her typical happy self and seemed a little more sluggish than normal. A call to the doctor suggested that they take her for a checkup, at which time her blood sugar levels were tested and found to be very elevated. The family was given an appointment the next day for further diagnostic testing with an endocrinology department at the Children's Hospital. Further testing confirmed blood sugar level elevations, and at the age of 3, Nora was diagnosed with type 1 autoimmune diabetes. How does Heather help Nora manage diabetes? Beginning on the day of the diagnosis, the family was naturally overwhelmed. This was exacerbated when they also had to immediately attend educational sessions on proper diabetes management practices. These sessions described how to safely perform finger testing, administer insulin shots, and learn about safe diet planning for their child. Nora started with insulin injections and had gradually transitioned to an insulin pump. Years of finger testing had transitioned to a continuous glucose monitor, CGM, which is a high-tech method to track glucose levels throughout the day and night. The readings are translated into dynamic data, generating glucose direction and rate of change. Data is accessible via smartphone and will give alerts as needed. We asked Heather what were some of the challenges that the public is unaware of about caring for children with type 1 diabetes. She responded, "Type 1 is 24/7. 365 days of the year. There are no breaks in care, testing, medicating. It can be mentally and physically exhausting for children and their families. Due to the complexities of type 1 diabetes, especially around medication and diet restrictions, many children miss out on activities and events that their peers attend. Playdates and sleepovers are difficult outside from their home and outside of the care from their parents. There are so many misconceptions and misinformation about diabetes, particularly regarding the differences between type 1 and type 2. Most people believe that all diabetes have the same causes and can simply be treated the same way by popping a pill, exercise, and diet change. This is not true of type 1, which is an autoimmune condition, meaning that the body attacks itself. Type 2 is mostly insulin resistance, and can often be treated by diet changes, weight loss, oral medication, and sometimes insulin as a last resort. With type 1 diabetes, you cannot take oral medications. Individuals can only receive injection or use an insulin pump, which has to be inserted under the skin. Continuous glucose monitors, CGMs, have to be changed every 10 days. Heather offers some tips to help a newly diagnosed family. Connect with another family. Seek support and resources from parent groups, the Juvenile Diabetes Research Fund, JDRF, the Connecticut Children's Medical Center, Yale New Haven Children's Hospital, and other nonprofits such as PATH, Parent-to-Parent Family Voices of Connecticut. Other parents provide emotional support, shared knowledge, and resources that have helped them. Try to plan ahead items such as buckets, boxes, or trunks with appropriate snacks, toys, and other treasured things that'll help your child to calm down during a difficult treatment day or a day when they don't feel well. Involving your children in care not only educates them about their condition, but it helps them to feel a small amount of control. It's really important for kids who cannot control their illness and have to follow a strict medical regimen to stay healthy. If it is an option, prepare your child to safely visit with family. If they are willing, teach loved ones and friends about your child's medication, equipment, and needs. Plan ahead for trips. Make sure you have enough medications. This means there must be a refrigeration system to store the meds. Let's now meet Nora. She was diagnosed with type 1 diabetes at the age of 3. Today, She is 14 years old. Nora was asked how she manages her day-to-day life with type 1 diabetes. She responded that she needs to continually check blood sugar numbers throughout the day, 3 to 5 times a week, and has to change the site of injection and carry around numerous supplies. How does it affect your day-to-day life? Do you miss out on any events? She responded that she usually does not miss out on anything due to diabetes, but she does need to make plans around site changes, especially during the week. It also affects her energy and concentration. Nora was asked what she would like people to recognize about type 1 diabetes. She responded, "People use the term juvenile diabetes a lot. That is an old term, rarely used anymore. The term suggests that type 1 diabetes goes away when a child grows up. That is not true. People have to start using the proper term, type 1. Nora also reports that there is nothing that she nor her mom did for her to get diabetes. It was something out of their control, but it will not change who she is, and she is not defined by it." As we learned in the previous video, there is no cure for type 1 diabetes. Yet, individuals can manage their symptoms and live full and productive lives. We would like to thank Heather and Nora for sharing their story with us and enlightening our discussion on type 1 diabetes. We'd also like to thank Emily Labogo for developing thoughtful and insightful questions and for conducting the interview, which was adapted for this video. This video is brought to you by PATH, Parent-to-Parent Family Voices of Connecticut. If you'd like to stay in the loop, follow us on Facebook, where you'll get updates on future episodes and other programs. Thank you.